Drew. Today we have a panel, and can we start with introducing yourselves today?
Yes, young lady. What is your name?
My name is Borden.
You said your name was,
Nina Borden.
oh, okay, good to meet you. Well, kids, I'm Dr. Ron Curtis. Went to school at USC. I've been a dentist for 23 years, and this is my team.
Hi, good morning. My name is Guadalupe, and I'm a registered dental hygienist. I've been working for Dr. Curtis for 2 years now.
I'm Dr. Delano Hankins, Dr. Curtis Associate Dentist. I've been working for Doc for like a year and a half. He's actually been my dentist since I was like 9 years old, so I've known him for a long time. But yeah, definitely inspired me to become a dentist.
Hi, I'm Claudia. I'm a registered dental hygienist, and I've been working for Dr. Curtis for about 3 years now.
So, first question is, why did you choose the career you have right now?
Well, kids, I chose my profession because I like to help people. It chose me. I have a kind of a funny story. When I was in regular college at USC, I wanted to become a pharmacist, just because my uncle was a pharmacist, and he sat down and talked with me. He said, maybe that's not a profession that you want to go into. So I thought, well, my undergraduate degree, I was graduating from college and I was getting a degree in biology. I said, maybe I'll take the MCAT, which is the test to get into medical school. And then I said, maybe I may not want to stay in school for 8 more years. So my mom, who worked at USC, had a friend who worked at the dental school. So I took a class my last semester in dental school, and it was called Intro to Dentistry. And growing up, when I was you guys' age, I was pretty afraid of the dentist. But taking this class actually enlightened me to see that dentistry is more than just drilling holes in people's teeth and filling cavities. We do all aspects of dentistry in the office, and dentistry is comprised of different things like oral surgery or endodontics, like doing root canals or braces, or different types of surgery. So it actually kind of picked me. By taking the class that I took my last semester, I got to see that dentistry was just more than just cleaning people's teeth or fixing cavities. It was actually helping people get out of pain, connecting with people, teaching people about overall general health, how it's related to your oral hygiene. So I actually, like I said, it picked me. It opened my eyes up to, it was just more than just filling cavities and cleaning people's teeth.
Hi, so I'm a registered dental hygienist, and I picked hygiene because it's a lot about prevention and oral health awareness and educating our patients, starting as young as 2 years old, on how to take care of their teeth to prevent disease, to prevent cavities, to prevent our patients from losing their teeth. So I really love that, being that person to not only clean teeth, but to educate and instruct them on how to better take care of their teeth.
So you guys, I chose to be a dentist, like I was saying before. A lot of it had to do with me coming to Dr. Curtis as a kid. Ever since I was like 9, I've been coming to see him. But honestly, I probably chose it for some of the wrong reasons. I remember, I never had any cavities, first of all. So Dr. Curtis used to just come in the room and tell me I look good and leave. I'm like, dang, he making all this money, not doing anything really, right? That was my mindset about it. Dang, he making all this bread, home doctor, you're doing something, right? And then I started like shadowing him like in high school. And I got to really see what he was doing. And I realized I still did like dentistry. So that's like really why I went into it. But I was honestly fortunate to have a dentist that looked like me. I'm not gonna lie to y'all. Like if I didn't have somebody that was personable, it was able to talk to me about my class in school, how I was doing in school, girls I was dealing with, and just being funny and being himself, I probably wouldn't have gotten into this field. So yeah, it had a lot to do with this man right here, man. And what you thought? But yeah.
So I had no clue what I wanted to do when I was in high school. I was just in high school trying to get good grades, and I started going to community college when I got out of high school. But I still didn't know what I wanted to do. And then I decided to join the Navy, the military. And when I joined the military, the US Navy, they told me, do you want to be a dental assistant? So I said, sure, let's try it. So I became a dental assistant. They trained me and I realized that I was really good at it. So I actually enjoyed it and I like helping people. And so I was in the military as a dental assistant. And then in the military, they give you money for school. Once you get out, you can go to school. So when I got out of the military, I decided to go to school for dental hygienist. And that's how I got into the dental field. So if it would have been for the military, I probably would have never experienced being a dental assistant. So it was a really good decision for me, and that's how I became a dental hygienist.
What was your career like before COVID-19 and how has it changed?
I think our careers before COVID-19 are the same now during COVID-19 and probably post COVID-19. I have 3 kids, okay? And they're a few years older than you guys. And this is what I always tell kids. I'm so proud of you guys. I've been coming to King Drew for probably the last 8 or 9 years. So I'm always impressed with the students that have basically decided to go into healthcare. I always say that healthcare is recession proof, okay? Technology can't replace us. It just helps us and it makes things easier. I've seen over the last 20 plus years doing dentistry and being a part of healthcare, how technology has made us more efficient. So as far as how our careers were, pre-COVID, we were just as busy pre-COVID and during COVID because people need healthcare providers. They need doctors, they need nurses, they need dentists. So I think the one thing is that you guys will help a lot of people when you grow up. And your like Dr. Hankins was saying, he saw me and he thought that what we did was easy. If you ask him today, 2 years out of dental school, he'll say it's not easy, it's hard. You have to be good at what you do and you have to be focused and you really have to care. But as far as, you guys are 14, 15, 16-year-old, I think if you pick healthcare, if you stay with healthcare, it'll be recession proof and you'll basically have the lifestyle that you wanted, whether it be enriching people's lives by helping them or helping your families or helping yourself. So there hasn't really been any change in our patient flow during COVID versus pre and during and post.
And what motivates you to work in the career you do every day?
I'll have Dr. Hankins answer that question.
Okay, so say it one more time. I was about to answer the pre and post COVID. Go ahead. I'm sorry.
What motivates you to work in your career every day?
What motivates me? For me, it's honestly giving good care to patients. Like I realized, I think Doc was talking about this. Like in dentistry, it's more than just you're drilling and filling on teeth. Like you really become friends with your patients. You know what I'm saying? And really motivating people to have a good smile is a big thing for me. Like I've had patients who in the past before seeing us, I'm kind of nervous to smile. That's the first thing you see when you look at somebody's mouth is their teeth, or look at somebody's teeth. First thing that people notice. So being able to fix that is like a huge motivation for me, honestly.
So for me, what motivates me is a lot of people hate the dentist. So when someone comes in and you can see that they're very scared, and you're able to calm them down and allow them to have a good experience at the dentist. And then when you're done with them and they tell you, oh, thank you so much, I thought it was going to be bad, and they had a good experience, that makes you feel good, and that motivates you to keep doing what you do, keep doing what you love. And I'm also a single mom, so I have 2 little daughters. I have 2 girls, so it motivates me. They motivate me to do a good job, so I can be able to provide for them as well.
Yeah, same reason for me. It's a patients motivate you to come in and do a good job and teach them how to brush and floss and care for their teeth at home.
When did you realize that the career you have right now was something you wanted to do? When did you realize that?
I'd say for me, when I knew that I had a platform to motivate people who looked like me and came from the same background I did. I grew up and I was the son of my dad was a janitor and my mom was a school administrator. I grew up in South Los Angeles. So once I realized that I had a certain platform that kids or people that looked like me or Guadalupe or Doc or Claudia didn't have to rely on athletics and entertainment, I knew that I could motivate people to say, hey, you don't have to be the best student. You don't have to be the person that gets straight A's. You just have to be, you just have to be the most motivated. You have to be the most determined. So when I realized that I had a platform to reach back and basically help people that look like me, that's what motivates me to stay in dentistry. Whether it be talking to the students at King or just the patients that come in and you can enlighten or enrich someone's life just by looking like them. So for me, it was just more when I realized that I had a platform where I can inspire people.
Well, I can't pinpoint the exact time that I chose to be a dental hygienist, but I was also in the Navy and I was an electrician in the Navy. So I know it's a lot different than dentistry, but I knew that once I got out, I wanted to work with people. I wanted to make a change, even if it's a small change and something that is, it's simple as brushing and flossing your teeth for most of us. So growing up, I did see a lot of kids with cavities. I had a lot of cavities, and these are things that could have been prevented. So I decided to go into this field so that I can maybe help someone better understand dentistry and how to care for your teeth.
And I got this field by default, okay? But I was a hooper, okay? I used to hoop. And then like when I got to like 10th grade, 9th, 10th grade, everybody just started dunking. I didn't have it. I hit up Doc, and the rest is history. I didn't have it in me, so my story.
So when I was younger, I used to hate going to a dentist. We never had a good experience, me and my brothers going to dentist. So when I got into dentistry, when I became a dental assistant and I saw everything that went on to make an appointment and to make people comfortable, that's when I realized, oh, I can, I used to be scared of dentists. I can be a certain way to help people not to be scared. And that's when I realized that I'm very, I consider myself very gentle, very kind, so very sympathetic. So when I would see patients that were scared and I realized that I had the ability to calm them down and help them relax in the dental chair, then I realized that I had picked a good career for me.
Seeing that your career is very people-oriented, how do you maintain good relationships with your coworkers?
How do you maintain good relationships with your coworkers?
These guys and girls, women, they're my extended family. I think if you choose your friends wisely and you kind of associate around like-minded people, you really won't have a problem in life. So try to stay around, try to keep company with people that have the same character traits as you. So everybody that's here, and we have more than just us, but I consider them not just my teammates, not just people that work here. I consider them my extended family. So I think we all get along, and just like family, sometimes you don't see eye to eye. Sometimes there are, bumps in the road, but it's like family. We just work things out. So I think that here, one of the joys for me coming here is to engage with everybody here. They know if I don't engage with them enough, I get a little sensitive. Okay.
Yeah, I think it comes down to listening and understanding. So listening to our patients, listening to our coworkers, and trying to understand where they're coming from. And if we don't understand, we ask. It's just communication.
I would say communication is key, like she was saying, first and foremost. That's key. Another thing we do is we go out with each other sometimes, like and hang out on weekends. I feel like that helps with the camaraderie as well.
Yeah, we just, for example, me and Guadalupe, we've been best friends for like, over
6-7 years.
over
since
six,
we
7
met.
years. We met in school when we were doing our prereq, so we have a pretty strong relationship. So it's really easy for us to get along at work. And as far as with other coworkers, yeah, you just, like Dr. Hankins said, you have to communicate and understand that everybody has different personalities. And you just have to be sensitive to everybody's feelings and just be able to communicate.
And what key points do you want our students to take away from your presentation today?
I think I probably say this to you guys every year, and I say it to my kids. Be determined. Once you start something, make sure you finish it. Try to enrich your lives and be exposed to things. Expose yourself to things outside of what you know, outside of your comfort zone. So, like I said, I commend you guys. You guys are, most of you are in the 9th grade, I think, but picking a career path in healthcare, stick with it. Stick with the prerequisites. It's going to get tough. The road to the end result, whether it be enriching patients' lives or enriching your life, it's going to be hard. But stick with it. It's going to, life will chisel you into a body of work that will help you to enrich other people's lives. So be determined and be motivated. It starts in your AP history, or starts in your math, or it starts in your geometry class. It starts in handing in that assignment. You have to be determined and motivated, and you have to be self-starters in life. Sometimes, people, they feel like they need other people to motivate them. You really have to say, I'm going to dig down and I'm going to go ahead and do it, because, right now you guys are in the 9th or 10th grade. 10 years will go by in a flash, and you'll, instead of being 14 or 15, you'll be 24 and 25. So really just stick with it and just kind of stay true to the course.
Yeah, well said, Dr. Curtis. Yeah, you're gonna have to put in the work. If you want to get to where you want to be 10 years, 5 years down the road, yeah, you're just gonna have to put in the work. And yes, it'll be a little difficult here and there, but you can do it. It's fine. I was able to do it. We all were able to do it.
And are you guys PreHealth students? Yeah. Did you hear me?
You guys can unmute yourselves, juniors, or write in the chat, give them something.
Are you guys all PreHealth students? Yes.
By a show of hands, like we see a lot of boxes on the screen. Eric, can anybody like raise their hand who is inspired of PreHealth? You guys white coats? One, okay.
So the reason why I asked that, okay. So you guys, first of all, I don't want you guys, I don't know how you guys' grades are, but I don't want you guys to have hangups or feel like you can't do something just because you have a bad grade here or there. The reason why I say that is because me personally, out of high school, I graduated like a 2.8, 2.9. And then I realized like in college, I had to turn up. So I went to Howard University, ended up with a 3.7, graduated magna cum laude, and then UCLA Dental School. And I'm saying this to say that you can do whatever you want to do in this world, okay? Like I wasn't always the smartest, I really just grinded. Like my friends always try to go out with me when I was in college. I realized I had a different goal. I would still go out, don't get me wrong, I pledge capital, all that stuff, but at the end of the day, I realize my main goal is to be a dentist. And all I'm saying is you can do whatever you want to do in this world. You're not be the smartest person to do it, okay? That's what I want you guys to just take from this. You do not have to necessarily just always kill in school, everything come easy, because it comes hard. High school's kind of hard. You know what I'm saying? I already know King Drew kind of is too. So for you PreHealth students out there, just don't give up.
I think that's well said, Dr. Hankins. We all, I know these, my teammates on a personal level, and we've all come from different backgrounds and different journeys, but all four of us here, we can all probably say that we weren't the smartest, but we were the most focused and the most determined. My high school transcript probably looked like some of your high school transcripts, okay? But I was determined. I was determined to basically, once I set that goal, it was a long path. It was high school, it was community college, then it was university, then it was dental school. So it wasn't, sometimes we get kind of caught up in how things in an ideal world are supposed to be, but it's not ideal. You just have to be hard workers, and you have to be grinders, you have to be grinders. And you have to be tough. You have to be tough and have a mindset of, like Dr. Hankins said, I'm going to kill it. And it doesn't necessarily have to be a reflection of grade. It has to be a reflection of attitude and motivation, because you will. There's very few of us in life that basically get to breeze through things, okay? But that's the way society sets the standards. If you don't breeze through it, you're not good enough, or you're not smart enough. Most of us don't breeze through things, okay? Most of us have to put in the work, and I think what you put in something, you'll get out of it. And it doesn't necessarily have to be a reflection of grades, okay? People, I know for me, my crew right here, they're all hard workers, and that's why I'm drawn to them, okay? They're hard workers. So I think, it's not a reflection of grades. If you work hard, teachers, counselors, college admissions officers, people will notice you, okay? So keep the whole thing is everybody can work hard. Everybody can work hard. And if you work hard, people will be drawn to you and doors will open up for you. So, whether you're the smartest person or not the smartest person, you need to be the hardest working person, okay?
Yeah, I agree with that. When I was in the dental hygiene program, and you guys, it was like the hardest thing I've ever done in my life, and I was in the military, and I would rather do that again, but not the dental hygiene program. It was really, really hard. And I could see that for other students, a lot of things came easier than they came to me. And, maybe they had to study just 1 hour for something, but I had to study 2 or 3. I was up till 2, 3 in the morning with my coffee studying. But like he says, like the hard work pays off. I didn't get straight A's, but I made it through with hard work and, just motivation, why, just thinking about why I wanted to finish the program. So yeah, you just have to work as hard as you can and you'll get through. Mm-hmm.
What encouraged you guys to give a presentation to our students today?
Well, for me, don't make me cry this morning at like 9:30, okay? Because I want you all to see that we look like you. And I need to inspire. I need to do my part, okay? I need to do my part and inspire people that come from the same backgrounds, whether it be where I live or socioeconomic backgrounds. I need to let people know that, doctors and dentists and engineers and lawyers and whomever, teachers, okay, don't all have to basically be cookie cutters and can't look like us, okay? I want to inspire you to believe that whether you pick healthcare or not, okay, anything is possible, okay? We just, we had, 8 years of an African-American president, okay? We have an African-American vice president right now. So I just want, I want to inspire us to be the best and show that whether you go to King Drew High School, whether you go to Inglewood High School, or whether you go to Manual Arts, or whether you go to, a fancy school, okay, that put in the work and be inspired. Be inspired not only to change your life, okay, and keep on the path, but once it happens for you, you know, it's your obligation to reach back to someone else, whether it's your children, whether it's your friends, whether it's, you know, people that look up to you. Yeah, but so I want to inspire people to the next generation to be better than my generation. So my motivation is for inspiration, and it's always been for inspiration. You know, I think that this is the United States of America, and it bothers me to come to work and see the problems that we have, whether it be social tensions or racial tensions or economic tensions. Okay, this should be a land of where anything is possible. So I want to show you what possibility looks like here in the dental field. Okay, this is possibility. Okay, and you just have to put in the work.
I wanted to let you guys know the different fields. It's not just dentistry, but dental hygiene. Like Claudia said, you know, we didn't really know that there is, well, personally, I didn't even know about dental hygiene until a little bit later. So it's an option. I wanted to bring that option to you. And if it's something that sounds interesting to you, look into it, maybe pursue it. We need more dental hygienists. We need more caring, loving dental hygienists.
And for me, it was like what Doc was saying earlier, just exposing out of the different people, different backgrounds. I'm sorry, same backgrounds as you guys doing different things. That's all.
Yeah, I grew up in East LA, and I don't remember anyone ever saying at my high school, you can be a doctor, you can be this, you can be that. I never ever had a presentation like this, so I had no clue about dental. You know, I got out of high school, I graduated with pretty good grades, but I had no clue what I was capable of doing or wanted to do. So I started just going to community college, but I wish that if someone would have come to me and spoken to me about something like this, then straight out of high school, I would have, you know, had a more clear mind of what to do. So when I heard about this, I thought it was a good opportunity, like they said, to expose you guys so that letting you guys know that these careers are available to you guys, and, you know, and anybody can do it.
Anybody can do it. Anybody. You just have to be determined, and you have to be able to embrace hard work, because nothing in life comes easy, whether it's doing great in your history tests or making up your bed in the morning or just helping out with your parents. Nothing comes easy. We all have to work. So, you know, you just want to embrace hard work. If you can embrace hard work, the sky's the limit. Okay, it really is.
And do you guys have any advice for our students today in general with college, you know, high school, career, etc.? And also, if you have any questions in the chat, you can ask.
What was the question again? Our speaker kind of broke up. Say it one more time.
Do you have any advice for our students today with college, high school, or career?
This is what I say. This is why I would tell my kids, okay, is that you focus on putting in the work, okay? Because if you put in the work, people will notice you, okay? And doors will open up for you. I hear so many times, even from where I came from, the cost of college and things being unobtainable and out of our reach from a financial standpoint, where we can't afford to go to college. Right now, what I would tell my kids is you focus on being the best student you can, everything else will fall into place, okay? You know, and so your job right now from 9th to 12th grade is just do the best you can, but put in the best work possible, okay? So sometimes people my kids would get kind of duped into believing that just because they did the work, it was their best work. You got to learn how to say, like, hey, if it hurts, you're doing the right thing. If it hurts, you're putting in the work. If you're spending enough time, I was very similar to Claudia, where and Dr. Hankins, where I disappeared for hours at a time or even days at a time to basically put myself in a position to, you know, study for, you know, 5 or 6 hours out of the day, putting in the work and understanding what work is. So your jobs right now, as far as wanting to go to college, those of you that want to pursue healthcare or want to pursue, you know, college after high school, is just make sure that you learn how to work and make sure that people notice you, okay? And the people will notice you if you work. But your job right now is to get the best grades possible and do the best work possible.
Yeah, stay focused. Just stay focused on what you're doing today, if you have an assignment to do, stay focused on that. Put the work in, put your hours in. If you don't know something, ask questions. You have so many resources. At school, I'm sure you have counselors, your teachers. We have the internet now, so use your resources. Use your resources if you don't know, and stay focused.
Advice. I'm like, okay, so what I did, I think you guys should do it too. If you are serious about pre-health, like, and this is for a couple years down the road. I don't know what grade you guys are in, but start doing this like 11th or 12th grade, like 12th grade probably. Like, start researching different postgraduate schools you want to go to. I know that's what I did. I know I wanted to either go to USC or UCLA, end up at UCLA. But I looked up the prerequisites and I put them as bookmarks on my computer. And I would just always look at them like kind of often to see where I needed to be and where I needed to get to. It was kind of motivational. So that help you guys.
And yeah, I would just say, stay focused, just take it day by day. Try not to think so much about down the road because you can get overwhelmed, because that's what I would do. That helped me back a lot because I would think about all the work that I had to do, in the future. And I was like, oh my God, I can't do that. So just day by day, focus on what you have to do that day, the task, and do your best that day and just take it day by day.
I think Claudia is giving you guys some really good advice. From the mindset of life is a marathon, but every day, every hour, every minute, you just have to put one foot in front of the other. If you stay true to your path, you'll finish the race. And so many of my friends, okay, growing up, I always felt like we all had the same opportunity. But it was just the level of commitment and staying true to the journey. And one of the key components that I live by is patience, okay? Things don't happen overnight. I came from the age of warming food up in the oven or actually cooking things, doing things that took a long period of time. And I think your generation, I joke around and say that your generation is the microwave generation, where you basically put something in the microwave, you set it for a minute and it's done. With life isn't a microwave. You really have to stay true and be patient, okay? Be patient and put one foot in front of the other. Keep on that journey.
And for our students, if you have any questions, you could put it in the chat.
Yeah, one more time.
Don't put the questions in the chat.
Oh, okay.
Open up the chat.
Okay. Will we see? Do we have to open up the chat?
Yeah,
No,
it should show up.
Oh, okay.
So I don't think there's any more questions. So
I can't believe no one has a question. Nobody?
well, I have a question. So I'm going to be starting college in the fall. So what advice would you have for that?
That expose yourself, get outside of your comfort zone, meet as many people as possible, and do as many things as possible. I think that we get kind of relaxed in being around people that look like us, doing things that we did as kids. So expose yourself. Exposure to things that you don't know about is knowledge and information, and I believe that's power. It creates scenarios where we could make a more informed decision. So get outside your comfort zone, join organizations, ask questions, take classes that you would not normally take, to be exposed to different things.
I saw a question about if do you have to go to college to be a dentist, to go to dental school? Yes, you do. but you don't have to necessarily graduate college. I actually had one girl that was a year under me who just took all the prerequisites needed, didn't graduate college, and was actually like younger than the rest of us. Like I started doing school at 22. She started at 20 because, like I said, she took the prerequisites and went. So that was a good question. I could ask that.
Where are the questions?
Right here, they're popping up. There's like 7. Hold on, y'all. I'm sorry.
Okay.
It's causing school, middle school. And I think you answered this. What advice do they have for seniors, for people that will be seniors in a few months? You just answered that, right?
So some of the students on the form this morning are in the 11th grade. Meet with your counselors, meet with your high school counselors, because they have a lot of information that you may not know, or people haven't shared with you yet. So I think all of you, I would say the advice to the juniors, okay, who don't know this is get everything in order to start taking exams, the SAT, to get in colleges. Start looking at colleges that you may be interested in going to and seeing what their admissions process is. And just from a parent who had 2 kids in college, sometimes we think just because we can't afford to go to college or maybe out of our reach that we don't apply. Colleges, sometimes you don't necessarily have to be able to afford to go to college, okay? And that was one of the things that I didn't know growing up, but I got to know that as a parent when my 2 younger kids went to college. You don't necessarily have to afford college to be able to go to colleges that you think are very, very, very pricey, okay? So my advice to 11th graders is to make sure that you take any exam to get into college, whether it's the SAT or the ACT. I don't know what it's like now because COVID has kind of changed things over the last couple of years, where you didn't have to take the SAT, I believe, last year. But things will probably return back to normal shortly. So if you haven't taken the SAT or the ACT and you need it, then take it, okay? If you have your goal set on whether it be community college all the way up to a 4-year private university, start looking on the internet and seeing what the admissions process is to get into those schools. And my thing is, even if you think you can't get into those schools, apply, because you'd be shocked how the admissions process works, okay? One of the universities I'm affiliated with, they kind of told me what their admissions process is. So sometimes we get out of high school and we want to say, everybody wants to be a doctor, everybody wants to be a lawyer, okay? So schools will ask what you want to be before you get into the school. So sometimes with admissions processes, the different schools, like the School of Music or the School of Accounting or the School of Arts, will admit students in based on the number of applicants. So sometimes an easier way to get into college is to let those colleges know that you want to do something that isn't so popular to get in the door. And then once you get in the door, then you can always change it up. But start looking, even if you think you can't get into a school, my advice is to apply to it anyway, okay? Apply to it anyway, okay?
The next question, what advice do you have for someone who isn't too sure about their career? Well, I look very potty, y'all should answer that.
I just take your time. I mean, like they say, better late than never. I got out of high school and I went to community college for like maybe not even a year. It was maybe like a semester, and I didn't know what I wanted to do. So I joined the Navy. So I was in the Navy for almost like 7 years. And then after that is when I was like, okay, I want to go to dental hygiene school. So it took me a while from graduating high school to when I started actually focusing on what my career was going to be. So, I just feel like, and once I knew what I wanted to do, then I was like, what do I need to do? And that's when I just became very determined just to get it done. So it took me a while, from high school to actually get into my career. But I think in my situation, it was a good thing, because there was a lot of things that helped me get to where I needed to be. A lot of things that prepared me, like, mentally wise. So I just feel like, just keep doing it, like little by little every day, just keep doing something towards your education. And then once you decide what you want to do, then it won't be as hard to get there.
Yeah, very much like Claudia. In high school, I wasn't sure what I wanted to do, but I was afraid to jump straight into college. For some reason, I was just afraid to go in there and mess up my GPA or whatever it was. So for me, it was the Navy that kind of straightened me out into a path that I was able to identify what I liked, what I didn't like, and then go from there. But I think that came from me not asking enough questions in high school and not really looking into my resources that I had. We had a career center. We had resources that I could have used, but I didn't. I didn't step out of my comfort zone, like Dr. Curtis said. Do that. Step out of your comfort zone. Ask questions. If there's something that you're interested in, find a counselor, find a teacher, and see if maybe you could start earlier in pursuing that career path that you want to.
And one other question, what's the best career decision you've made? I can start with that. For me personally, it's actually like, you don't really hear a lot of dentists say this, but I feel like the best career decision I made was being able to kind of intertwine dentistry and rap music. So like I make like rap music on the side, and I've always like been interested in rapping ever since like a kid. But I never knew how to intertwine them both until dental school. So I started making like dental related rap videos, or just rapping about my life, kind of like in dentistry, what's going on in my life. And I feel like I've gotten a lot of attention and attraction from online patients and people on Instagram and things of that nature from doing that. So I feel like that just gave me a lot of free marketing. That's probably like the smartest decision I made. Yeah, because like that's another one of my passions as well. Kind of like intertwining and making them both like fun. Yeah. Oh, and the next one, for those who serve in the Navy, is there any more information you have about medical positions in the Navy?
I don't have any information on that. I was an electrician in the Navy. Sorry. I'm sure.
I don't have any personal experience of being in the military, but the one thing that I remember when I was in dental school is that the certain branches of the military came to the dental school, and they were willing to pay for my education in dental school, and then give me a job after dental school in the military, which I'd get a pretty comfortable paycheck and a pretty comfortable position. So it goes back to what I was saying. Be exposed to things, ask questions. If you're thinking about a secondary education, thinking about college after high school, there are a lot of ways that we can end up at the end result, and sometimes looking, we can't afford it. So, and there are a lot of opportunities out there, whether they're private or public opportunities. I think my best decision in dentistry was to meet as many dentists that look like me as possible. I have a great group of mentors who have given me a lot of advice on just how to relate to patients, how to do clinical dentistry, how to run a business, how to manage just myself as a person. So try to surround yourself with people, meet as many people as possible. Okay, people love to help other people.
And that's what do y'all think is the best path after high school?
Go ahead.
No.
I'm a traditionalist, kids, okay? Because I have kids. The best path after high school is college, okay? I'm not gonna sit here and tell you any different, okay? The best pathway is college, lots of college, okay? And do something that a machine can't replace you by. It goes back to the advice I give my kids, okay? I'm sitting here as a healthcare professional and I swear by it, okay? Healthcare is recession proof. So I'm a traditionalist. Pick a traditional career path. Obviously, that's not the only career path, but I'm a traditionalist.
Okay, so when it comes to, that's great. So after high school, I feel like you should go to college for a career that will make you some money after college. Don't just go to college and be $40,000 in debt and not really have a career that can pay for that, in my opinion. So like I'm saying, like in engineering, doctors, lawyers, things of that nature, are good for college, business. But sometimes, I'm not gonna lie, for some things you don't necessarily have to go. Like I have a couple friends that didn't go to college, musicians, actors, things of that nature, and are doing great. Some people that I have friends that are in tech that dropped out, they're doing great. So I don't want people to think, oh, I gotta do this and get all this debt and then have nothing to really show for it. So in my opinion, I think you should go to college if you have a career that can pay for it. Or if you need to go to college in order to get to that career, like for example, a teacher, things of that nature. But yeah.
Yeah, I feel like everyone's different. But if you know for sure what you want to do, I would say go to college. Education should be a priority. I didn't know, so I joined the military. What I don't recommend is don't just sit around and do nothing. And just because then you're just gonna put yourself more and more behind. So, me, I didn't finish, my community college, but I went to the Navy, and that was kind of like teaching me other skills that I didn't know I had. So I never just sat down and settled, and I was like, well, I don't know what I want to do, so I'm just gonna wait. No, so you just have to stay active and always keep education in the back of your mind. That's the most important.
Another, what career mistake has given you the biggest lesson? Go ahead, Doc.
Career mistake that's given me the biggest lesson. I'm gonna answer honest. My honest answer would be none, because like I tell Dr. Hankins, when Dr. Hankins, I'm gonna tell you guys a story, okay? When Dr. Hankins graduated, his dean spoke to the graduating class, and what we do the practice of dentistry, okay? And practicing means that you want to be better the next time or the next day than you were the day before or the week before, or the year before, okay? When his dean said that, out of 300 people in the auditorium, I stood up and gave him a standing ovation, okay? And I think I probably looked a little crazy, because we're gonna make mistakes in life, okay? So mistakes are teaching moments. Mistakes are inspiring moments, okay? Don't ever think that the classmate to the right or left of you, okay, hasn't struggled like you, okay? So failure to me is motivation not to fail, to be better. So I kind of embrace failure. The one thing in dental school that they didn't teach me, that I so inspired to teach him while he was in dental school, is that failure is normal, okay? Don't let it break you down. Don't let it eat at you. Let it inspire you, okay? So mistakes in life are human. We're human beings. We're all going to make mistakes. Let it inspire you and let it motivate you to be better, to focus, to figure it out, okay, to think. So mistakes are, embrace your mistakes, kids. Embrace it, learn from it, and be motivated and inspired by it.
That's it. That's it.
Yeah, I think that's all.
Anybody want to ask some questions that they think they ought not ask us, because they would be embarrassed? The one thing that kids always ask when I'm there in person, okay, is how much money could you make, or how much money do you make? I think I probably get 3 kids from the class will pull me to the side, or somebody will ask that question, okay? You can do really well in healthcare, However, okay, this is what I tell him, and I've probably shared it with these two young ladies as well, is don't make money your motivation, because if you make money your motivation, you won't have anything, okay? People see through that really quickly, okay? Money is a byproduct of success and passion. Be passionate about something. If you're passionate about something, the money will come. If you do it for the money may come, it may not, okay? But if you're passionate about something and you do it for the right reasons to help people, to inspire and to motivate people, it's going to come, and you can make a lot. You can make a lot and live well, okay? You know, you can go to the store and say, okay, you know what? All those potato chips on aisle 6, I can put them all in my grocery bag and I can get them all, okay? So, you know, any questions? Anything?
Well, unfortunately, I think we are running out of time, even though this is amazing. The students have another class and we have to let them dismiss, but this was awesome. I'm inspired today. I'm gonna, make a point to absorb all the good advice. And Dr. Curtis, thank you so much for always coming to our career days. You make such a difference. And King Drew students, please know that he is the dentist of King Drew. You can ask almost anyone here, that's their dentist. My mom went to him, Miss Golden's whole family, like so many people at our school use Dr. Curtis because he is amazing. His bedside manner is awesome and his staff as well. So we are so thankful for you today.
I love you too, okay? I love you, okay? Just before we go, I just want to
Yes.
extend the invitation to any kid that's on, any student that's on our Zoom call. My number, and I'm always available, and these guys and girls, all my team, we're all available for kids that just want to drop by, kids that just want to shoot the breeze. I'm always, my door has been open since 1998, and he's like my biggest seed. He's like the kid that I never had that I had, okay? So if anybody wants to just come and visit the office, if anybody wants to have a private chat, a telephone call, I'm old school, so I don't really do texting and all that stuff, Instagram, but you can get it from anybody in the school, okay? And we're all available. So I want to leave you guys with that.